Welcome to the Department of Human Services webinar series, Strengthening Iowa's Child Care System. The series outlines the changes to Iowa's child care system based on a federal law that was updated to include new requirements. This particular webinar is designed to cover the changes for licensed child care centers or preschools. We will cover three main topics: background research on why these changes are important, information about the reauthorized federal law, and specific rule changes that will be happening for child care programs. Additionally, there will be changes to the Child Care Assistance Program, which will also affect licensed programs. There's a separate webinar that discusses these changes, titled Changes to the Child Care Assistance Program. Please watch that webinar to learn about those important changes. Child care is often the silent service in communities that allows parents to work or go to school. In the last 10 years, there's been considerable conversation and action related to preschool. However, the importance of quality child care for all is also gaining more traction at the federal level, as well as in conversations within our state. For more than 10 years, neuroscience research in the area of brain development has identified the importance of the first few years of life. You, as a child care provider, play a critical role in helping build children's brains by providing a safe, caring, nurturing, and engaging early learning environment. You likely already know this, but I want to recognize your role in building better brains in young children. To put it all in perspective, Iowa ranks #1 among all 50 states, with 76% of households with children under age 6 having all available parents in the household in the labor force. The national average is 65%. During the first 2 years of life, way before a child steps foot in an elementary school setting, 700 new brain synapses happen per second. The synapses connect the neurons in the brain. Since brains are built in stages, with more complex structures built on simpler structures, it is extremely important to build a strong foundation in the early years. Take a moment to think about the children your center is caring for. What is the average amount of time a child is in your care? 6 hours, 8 hours, 10 hours? If we think about the 700 new synapses that happen per second in the first 2 years of life, if a parent drops their child off with you at 8 a.m. and picks the child up at 5:30 p.m., that child's brain has changed in almost 24 million ways during that time. Caring and nurturing early learning environments help young children develop social and emotional skills. These are skills like communication, problem solving, creativity, emotional control, critical thinking, teamwork, and ethics. In the workforce, these skills are referred to as soft skills or people skills, and employers are looking for employees with these skills. Childcare is important to your local and state economy also. Parents need childcare to be able to go to work or to school, and employers need employees to be able to locate a business in a community. Now let's take a look at how we got to where we are today and the changes we are preparing for. On the federal level, Congress reauthorized or changed and updated a law called the Child Care and Development Block Grant. This is a law that gives federal funding to help low-income families pay for child care and to improve the quality of child care for all children. The law was originally written almost 20 years ago, and much has been learned about child development since that time. The changes in the reauthorization represent a paradigm shift for child care in our state. The previous version of the law viewed child care as mainly a work support for parents to participate in the workforce and gain economic stability. In the reauthorized version of the law, the purpose of the fund was expanded to recognize and include child care's role in promoting healthy development of children in high-quality child care programs. Iowa uses the money that we receive from this law for the Child Care Assistance Program, DHS regulatory staff that do monitoring visits, and for quality improvement activities for child care providers, such as child care resource and referral, Iowa State University Extension Environmental Rating Scale Assessments, Quality Rating System bonuses, and Child Care Wraparound grants. As part of the law, Iowa submitted a state child care plan. The plan outlines how Iowa will meet all of the federal requirements. The Department of Human Services asked for public comment on the plan over many months, and the plan was submitted to the federal government on March 1, 2016. You can find the copy of the state plan that Iowa submitted on the DHS website. If you go to the Providers and Partners tab on the main website, you will find a heading called Child Care. Under the Child Care heading is a link entitled Reauthorization of the Child Care and Development Block Grant. That will take you to a page where you can view a copy of the Iowa Child Care and Development Fund State Plan. In the rest of this webinar, we will focus on 3 major areas of change that will be significant for licensed programs. Major areas of change include Child Care Assistance Program, health and safety changes, and consumer education. For a more detailed account of all the state's plans for the changes required by the reauthorized law, please refer to the state plan on the DHS website. Child Care Assistance is the name of the program that helps eligible low-income families pay for child care while parents are working or participating in education or training. The majority of the funding for this program comes from federal funds. There will be many changes to the Child Care Assistance Program in Iowa based on the new federal law. These changes include moving from 6-month to 12-month eligibility periods, allowing for temporary changes in work, training, or education activities, allowing for a longer job search activities period during the 12-month certification, a new exit eligibility program, and changes to reimbursement rates for some child care providers. The Changes to Child Care Assistance Program webinar provides more information about all of these changes. Another area of change will be health and safety. There will be changes to Iowa administrative rules for child care programs as the federal law puts the health and safety of children as a high priority. The majority of these changes will take effect on October 1, 2016. Let's take a bit of time to review some of the most significant proposed changes. Keeping in mind that this is an overview, DHS will share more detailed information about the administrative rule changes in the coming months once the rules are finalized. Starting October 1st, 2016, all staff that have direct care responsibilities must complete an orientation health and safety training course that has specific training topics that are identified in the federal law. The topics covered in the training include prevention and control of infectious disease, prevention of sudden infant death syndrome and safe sleep practices, administration of medication, prevention of and response to emergencies due to food and allergic reactions, building and physical premises safety, prevention of shaken baby syndrome and abusive head trauma, emergency preparedness and response planning, handling and storage of hazardous materials, and precautions in transporting children. Iowa has also chosen to include information on working with children and families of diverse backgrounds and families experiencing homelessness as it relates to other requirements in the new federal law. In Iowa, we are using the title Essentials to refer to the series of courses that is being developed to cover these topics. The Essentials Health and Safety Training course will be available for free online or in person. This module-based training is in its final stages of development with our partners at Healthy Childcare Iowa and Iowa State University Extension and Outreach. Here is a sneak peek of one of the handouts offered with the modules. As soon as it is available, the department will share more information with you about the training. Additionally, all DHS licensing consultants who are completing monitoring visits will be required to complete this same health and safety training course. This course will provide a foundation of basic health and safety information that all child care providers should be aware of. The course being developed covers all of the topics in 12 hours, so it will be the basics of each topic. You may find you want to seek more in-depth classes about some of these specific topics after taking the training. In the future, other child care professional development agencies may develop courses that cover these topics. The department will have to approve any courses that count for this requirement, so be sure to verify that a course counts before taking it. Now let's look at how the requirement will go into effect. Starting October 1, 2016, all newly hired staff will have 3 months to complete the health and safety training. The plan for current staff is to phase in over the next year. Directors, assistant directors, and any staff responsible for the operation of the center in the absence of the director and assistant director will be required to take the orientation training within 3 months. By 6 months from October 1, 2016, the expectation is that half of the program's current staff will be trained, and that 100% of current staff will be trained by October 1, 2017. The new federal law identifies specific areas that must be in emergency preparedness plans. The plans must include procedures for the following: evacuation and relocation of children, shelter in place, lockdown, communication and reunification with parents or other adults responsible for the children, continuity of operations, and procedures to address the needs of individual children, including those with functional or access needs. This requirement is effective October 1, 2016. The orientation training will provide basic information on creating emergency preparedness plans. Also, DHS is currently collaborating with key partners such as Iowa Department of Public Health, Healthy Child Care Iowa, Child Care Resource and Referral, and the Office of Homeland Security and Emergency Management to provide guidance and suggestions to programs for developing emergency preparedness plans. A planning guide will have an emergency plan template and tools and letters that you can use and adapt to fit the needs of your child care program. You are not required to use these forms or templates, but you may at your choice. Once the planning guide is finalized, we will provide it to our child care resource and referral partners who can distribute it to the child care programs. We are also sharing information about the new requirements for child care programs with county emergency management coordinators. Child care resource and referral, child care nurse consultants, and county emergency managers are all great resources as you develop your emergency preparedness plan. The law also requires professional development and training requirements to improve the knowledge and skills of the child care workforce. One part of this requirement is a progression of professional development opportunities. Early Childhood Iowa has already developed a pathway that helps professionals in the early childhood field understand the career opportunities available to them and the recommended training for each option. Recently, an interactive web-based tool was developed to make this information more accessible to the child care workforce. The pathways can be found at www.ecieducationpathway.org. Let's take a quick look. On this website, you can answer questions about where you are at today, look at options available in the early childhood field, and make a plan for where you want to be. Additionally, a group of stakeholders has been assembled to give input on trainings that could be relevant to staff that work with school-age children. Another requirement in the law that Iowa already had in place is early learning and development guidelines. The Iowa Early Learning Standards, most recently revised in 2012, are a resource for child care providers, parents, and others who care for or work with young children. These standards describe the knowledge, behaviors, and skills from birth to 5 that children can demonstrate. Knowledge and understanding of these helps adults to support and enhance children's early learning and development. A link to access and print these standards can be found on the Early Childhood Iowa website at www.earlychildhoodiowa.org. The final area of changes this webinar will highlight is consumer education changes. The federal law has a focus on promoting family engagement through consumer education. To help parents make informed child care choices, the new law requires Iowa to make consumer education resources available electronically. DHS will provide this information to families and the public on the department's website at www.dhs.iowa.gov. Requirements include posting specific information such as the results of monitoring, inspection, and complaint reports, and what background checks are required for child care providers. Iowa must also provide information about the process for licensing, registering, and monitoring child care providers, and annual data for the number of deaths, serious injuries, and instances of substantiated child abuse that happen in child care settings. Let's take a quick look at where this consumer education information can be found. If you go to the main DHS webpage and click on the Can We Help tab, there is a heading for childcare. Once parents are on the childcare page, there are multiple menu options on the left-hand side of the page. The Tools and Resources link offers parents numerous sources of information on childcare and on child development. If I click on the Compliance and Complaint Reports link, it takes me to a page where I can search for reports on a child care facility. I can search for reports by program name, provider ID, type, county, or city. The Department of Human Services hopes that you have found this webinar on changes coming to Iowa's child care system helpful and informative. We want to thank you again for your efforts in providing safe, caring, nurturing, and engaging learning environments to the children of Iowa. There is a frequently asked questions document available on the Iowa Child Care Resource and Referral website that may answer some of the questions you have. If you have additional questions, please start by contacting your local Child Care Resource and Referral office. Also, if you have not signed up to get emails from Child Care Resource and Referral, we recommend that you sign up so that you get the most recent updates, information, and resources available. Contact information can be found on their website at www.iowaccrr.org or by calling 1-877-216-8481.